Hello, everyone. My name is Simran Chaudhary, and I'm delighted to welcome you all to today's special session titled Think Pink, Act Now, Screen, Fight, Win, organized by Voice of Healthcare and proudly supported by Cadila Oncology to mark the occasion of International Women's Day as we celebrate the strength, resilience, and remarkable contribution of women across the globe. It is equally important to shed light on critical health challenges faced by women, one of them being cancer. And this session aims to emphasize the importance of early detection, routine screening, timely treatment, and creating widespread awareness to improve cancer survival rates among women. And today we are truly honored to have with us Dr. Pratik Patil, a highly esteemed expert dedicated to cancer care, patient advocacy, and advancing treatment protocols with his exceptional expertise and unwavering commitment. Dr. Patil has played a pivotal role in transforming cancer care by ensuring timely diagnosis, personalized treatment, and compassionate support, ultimately improving patient outcomes and quality of life. Welcome to our show, Dr. Sir, Dr. Patil.
Thank you so much, Ms. Simran, for the lovely introduction. I'm honored to be here.
Thank you so much. So, in today's session, we'll discuss early detection, breaking screening barriers, and advancements in cancer care, and how women can take charge of their health. So, our goal is to inspire awareness, encourage regular checkups, and reduce the fear of cancer. So, without any delay, I would like to start with the conversation by why is early detection so critical in improving cancer survival rates? If we can share a real life case study where early diagnosis would have made a significant difference.
Yes, definitely. So, given for any cancer, be it breast cancer or any other cancer, early detection is extremely important because the cure rates are directly proportional to the stage of cancer the person is diagnosed in. So, when a person is diagnosed with stage one, the cure rates exceed up to 100%. Whereas a person who's diagnosed with stage 2 and 3, the cure rates are still there, but they are less than that of the stage 1. And stage 4 cancers, which are late diagnosed, they do not have any cure rate. The cure rates are less than 10% in those cases. So it is extremely important for every person to present to the doctor immediately when the symptoms appear, and also to diagnose these kind of cancers. It is very important because it puts a big impact on the treatment and the cure rates of the cancer. A live example I would like to tell you just of the morning case today. I had a fit lady, 60 years old today, with a good amount of breast mass that she had presented with. She's been observing this mass since the last 4 months, but did not report to anyone in the family or to any doctor, with an assumption or a misconception that it was not paining her. So she wanted pain probably to go to the doctor. And now, when the mass was too big enough, when it had already touched her internal structures from inside and the pain had come, she had presented today. So unfortunately, she's landed today to me in stage 4 breast cancer, which is not curable. She will be living for few more years with the treatment if she takes it further. But if she could have presented in the earlier stages 4 months back, we would have given her 100% cure rate, and her survival would be as normal as for that age and sex. So presenting early is extremely important.
So, like you just said, that if she would have presented 4 years before this, the cure rate could be 100%. So, how frequently the stage, changes? How frequently it goes up? Does it depend from body to body, person to person, or how it basically affects or spread?
Yes, so there is no particular notion or a blanket statement for that. Every cancer is different. Aggressiveness of every person's cancer is different. So, person A and person B, both of them having, for example, stage 3 breast cancer, both of their cancer would progress at a different rate, which we generally get to know through the biopsy of cancer, which is generally done before starting the treatment. So, with the biopsy, we get to know the aggressiveness of that cancer. And if the aggressiveness is very, very high, then it transforms from stage 1 to stage 2 within 1 month, that is 30 days. But if the aggressiveness of the cancer is not that high, then it would transform from stage 1 to stage 2 to as slow as 6 months.
Okay, thank you so much for explaining that. As we just discussed a case of which have come to you today only. You know that it was not paining, so she didn't bother to come to at your clinic. So, what could you say that could be the biggest barrier preventing women from undergoing these kind of regular screenings like mammograms, pap smear, or genetic testing? And how can we, break these barriers, especially in the rural areas or the underserved communities where the education or awareness is much lower as compared to any other, urban areas?
So body change is something that you should be looking at. Body change, if you lose weight, people generally get happy with it. They should be happy with it, but not for an unintentional weight loss. If it's an intentional weight loss, that is very well celebrated and all, but unintentional weight loss should not be celebrated. It indicates a problem in your inner body. So when any change happens in the body that is sudden and which was not intentional, which could be asymmetry in the body, which could be any swelling in the body, which could be any ulcer or a break of barrier leading to bleeding in the body, this should be notified to the doctor immediately, and let the specialist handle the case and let them do the thinking. Most of the time when we get the patients and we ask them this question, that why didn't you come 2 months back if you noticed this change 2 months back, the general answer that they give is we thought this and we thought that. No, don't do thinking. Please let the specialist do the thinking. There is a reason why he is a specialist, and that is something that everyone should understand. If something is wrong with my car, I'm not going to check it on Google and do it myself. I'm going to take it to the mechanic because he's an expert of that car. He knows exactly what has happened and what could be done. So same thing should be done with the human body as well, and people need to understand that you need to report to the hospital. Nowadays, not going to the hospital for 50 years of my life is not something to be proud of. If you've not gotten yourself checked, of course you're inviting problems. So that is how the generation that is coming up now should be changing their thought processes and getting at least annually checkups done from their doctor. Nowadays, it's a very bad habit of everyone that they just do the battery of tests that all of these corporate lab people advertise in the newspapers and on all the media platforms. 3,000 rupees, 2,999, get entire body checked. What are we checking? Blood levels. Oh, blood levels do not indicate any kind of cancer in the body, any kind of heart attack in the body, any kind of BP problems in the body. It only indicates diabetes and thyroid, which are hormone based. So people need to understand that blood test is not a ramban upai to diagnose all kind of problems, but you need to go to the doctor and get yourself checked. It is not only the blood test, but there are number of tests that are needed to be done, which includes a chest x-ray, that includes a sonography of your abdominal pelvis. So diagnosing some problem is not very simple, and I think you should just hand over yourself to a diagnostician or a specialist to do that, and should not think a lot about it.
Very rightly said, sir. Do not think much about it. Just go to a doctor, to a specialist, who can take care of your all the myths and misinformation in your head, and answer probably all those things. So I think we need more and more such kind of awareness and less misinformation, which is being spread to with from the flyers and the banners and everything out there. So we know there could be many other factors for the cancer, but what role does family history play in determining women's cancer risk, and how can the genetic testing help in this proactive healthcare, diagnosis?
So family history is extremely important. I would say that close to 37 to, I'm saying it based on scientific data that we have, that close to 37 to 38% of the breast cancers or women cancers are associated with a genetic history. So I always say that, our body is like a gun. In which the genetic or the part of the gun, the mechanics of the gun is given to us by our family, our mother and father. But to press the trigger or not, it is in our hand, which is the environmental factors. So the gun is already there. What is in our hand as to whether to let the trigger off or to press it. So environmental factors and genetic factors both play a extremely important role, and that is what I want to emphasize on, that you need to visit an oncologist and get an information about your family genetics. You need to tell your family history to the doctor and get uh, the organ at risk identification. So once your organ at risk is identified, we can give more emphasis on testing those organs. For example, if I have an history of my maternal aunt who's been diagnosed with breast cancers, I'll be focusing more, even being a boy, I'll be focusing on my chest area, on my stomach, on my pancreas, because these are all the organs that are related to familial genetic cancers to my maternal side of the family. If I have an history of my father who's been diagnosed with, let's say, kidney cancer, I'll be focusing more on my kidneys and intra-abdominal organs. So this is important to know whether what organs I'm looking at, because all organs cancers do not have blood test. It is not that simple. So all of the organs do not have blood tests that would diagnose your cancer very early. Only and only when you're looking at those organs at least once in a year through a sonography or an x-ray, you will be able to pick up the signs of development of cancer in that. So identifying your organ at risk is extremely important.
Thank you so much for shedding light on how this genetic testing and the family history play an important role in, the risk of getting cancer. But since we're talking about the factors and the prevention and everything, with the help of advancements in technologies, we have, come a long way ahead with the advancements and the targeted therapies and many other better options. So, what are some of the most promising breakthroughs in breast cancer, cervical cancer, or ovarian cancer treatments today we have?
So right now you must have seen many of the corporate companies where they have more than 50 employees in an office. They are doing something called as a thermal examination of the breast. These are the scans that are very much easy to be done. These are portable machines that could be taken to some office, and the scans could be done over there without removing any part of your cloth. So these are something that are AI driven, and the reporting is also done by an AI machine, because there's no doctor actually involved over there. But the sensitivity and the specificity of these machines is not yet par with the machines that are available in the hospital today. So AI definitely is coming a big way in diagnosis of cancers. The treatment and all is definitely not yet superseded by the human thing, but AI is definitely coming up a big way in the diagnostic modality. So early diagnosis, early detection of cancers, early prediction for detection of cancer. These are all the things that we are focusing more, where AI could give us a better, clear-cut idea, or even help us in diagnosing these kind of patients earlier.
uh, as we also know that AI is getting into the diagnosis, but there's one other buzzword which is precision medicine in oncology, right? So how do you think that precision medicine is reshaping the cancer care for women?
So precision medicine is basically personalized oncology. Like I told you, patient A and patient B, even if they are both diagnosed with the same kind of cancer with the same stage, the treatment of them could be different. Because nowadays, cancer treatment is getting very much personalized, which is basically precision oncology. And this is all done on testing of the tissue. So if we identify a lump in, let's say, lungs, so we get a biopsy from that lump in the lung, and we study the biopsy sample, which is the tissue basically, because there are some mutations that are happening in the body which has led to that lung cancer. So we study these mutations, and nowadays we have a lot of immunotherapy and targeted therapy tablets and injections that are available to fight these genetic mutations. So if you directly treat or fight the genetic mutations which are the causative factor of that lung cancer, the treatment modalities improve a lot, the longevity of the life improves a lot, the curability improves a lot, and the quality of life improves a lot as well, because immunotherapy and targeted therapy generally do not have any side effects. And that is why precision medicine is something that will hold the future of cancer treatment throughout the globe.
Thanks a lot for clearing, basics of about precision medicine. But I believe you witness or deal with lots and lots of patients every day. So, what do you think? How has the approach to treating women's cancers evolved over the past decades, and what are some of the biggest changes you have witnessed in the treatment protocols? If I have to ask.
So immunotherapy is something that is coming a long way now. Basically, like all the other things, we are going back to basics. What is immunotherapy? Immunotherapy are injections which are taken once in a month, or once in 21 days, or once in 14 days, depending upon the type of cancer. Now, as the name suggests, immunotherapy, what does it do is like it increases the body's immune response.
Dr. Pratik, am I audible to you? Because we cannot see you here. Yes, yes, I can.
Hello.
Yes, I can see you. I can see you now.
Hello.
Yes, you're audible, Dr. Pratik. Dr. Pratik, I cannot hear you. Your mic. Yeah, you're
Yes.
back on screen. Yes. So you were talking about the approach which has changed over the past decades, immunotherapy.
Yes, so immunotherapy is something that stimulates your body's immunity power to 20 times. So this is going back to the basics where we have identified that because your immune system of the body is not doing or functioning properly, the cancers pop up in your body. So we basically give you injections that stimulates the body's immunity power, which fights with the cancer on itself. Now the beauty of this immunotherapy is it does not have any side effect. And the problem of the immunotherapy is that it is very expensive today in India, especially for the patients who are not on insurances. Still, immunotherapy, to give a rough estimate of, let's say, lung cancer, the immunotherapy for lung cancer was costing somewhere around 30 lakh rupees per year in 2020. Now it has come a long way and it is costing somewhere around 9 lakh rupees per year today. So definitely as we go forward, it's getting cheaper and cheaper and more people are able to afford it. So immunotherapy is something that every cancer patient should be looking at and trying to get it.
So this was about how the changes have, the treatment has evolved over the past decades. But if
Yes.
you could dispel one dangerous myth about cancer that women believe, what would it be?
The major myth about cancer is the side effects. Most of the women, the first question they'll ask about is hair loss. So, what I want to emphasize on is you need to concentrate on the effects before the side effects. Indians have a very bad habit of asking a side effect of everything without looking at or without studying the effects of it. We are doing this kind of therapy for some kind of reason. We are giving it to kill the cancer. So I think we should concentrate more on that rather than looking at the side effects. Hair loss is completely reversible. Any side effects that you have with cancer therapy are completely reversible. So you should not be looking at it. These are just short term side effects that you deal with.
And also, we discussed about the family history of cancer. But are there any specific lifestyle factors that often, women overlook but can significantly reduce their cancer risk?
Yes, definitely. So, in the environmental factors that I was talking about, nulliparity, that is like not having a child in her lifetime, getting married after the ages of 35, not breastfeeding her children, after that, having multiple sexual partners, not having cervical cancer vaccination. These are all the environmental factors that women expose themselves to for developing any kind of cancer. Of course, not to forget alcohol intake, smoking, all of these environmental factors contribute to increasing risk of cancer in them.
And I guess these all are modifiable risk factors which can be worked on, and we can avoid the risk of
Yes,
cancer.
right.
So, yeah, as we're talking about the treatment and the myths, misinformation, and everything they believe, there's one important factor which comes, in the journey of the treatment, or just breaking the news that the person is diagnosed with cancer. That is the emotional factor. How important is counseling and emotional support in treatment, and do we need to integrate more psychological care into oncology for the patient and for the family as well?
So, emotional factors are extremely important as we break out the news of cancer to, let's say, 50 patients in a day, then almost 42 patients would will cry in front of us sitting in the OPD itself. So it's an extremely difficult news to digest for anyone. It comes as a big shock. No one is expecting to be diagnosed of cancer ever, even in the saddest dreams of theirs. So a trustful or a supportable partner, a supportable family is extremely important in these kind of cases, and also the use of psychologists, psychiatrist, and supportive people is extremely important. We generally, when we do chemotherapies at our center here in Jupiter Hospital, Pune, we have a team of psychologists, psychiatrists, and even nutritional helpers who guide throughout the treatment of these patients, and they also provide psychological support to them during the treatment. Especially it's very important for women who are getting the side effects of hair loss, nausea, vomiting for temporary duration. So psychological support is extremely important for them, and we have many people now who are taking up this as a profession.
Very, very rightly said, and I believe, like you said, it's with the patient and the family both needs equal support. And if they are in a correct mindset, ready to accept what is happening with them in a stable condition, I think they will perceive the treatment in a better way, and it will affect them much better.
Yeah.
So, as we have come close to end of our discussion, my last question would be: as it's an ongoing series of International Women's Day, what advice would you give to women today to take charge of their cancer risk and overall health?
So one thing that is extremely important is, if you are really serious about your health, once in a year you need to visit your oncologist, who will identify the organ at risk for you depending upon your genetic history, your personal history, your family history, your all the history. So he will be charting out the organ of risk. It is not same for everyone, you know. So you have to go to the oncologist to identify the organ at risk. And every year, same month, let's say February, so every February of every year, you should be visiting the doctor and getting checked these all organs that have been identified for you. If you do this, you will be catching the cancer in the early stages. There is no missing out. But if you do not do this and you take things for granted, or you do a lot of thinking on your own without taking professional help, then you're going to land up in the later stages of cancer diagnosis, which is not going to be good for you. So if you have any symptom, any simple symptom that may or may not be pointing towards cancer, you should be discussing that with your oncologist.
Very clear and concise that what exactly you need to do. And thank you so much for stressing upon that important fact that you need to go and visit your oncologist for a regular screening yearly, and how will it make a change in your life and your future. So thank you so much, Dr. Patil, for sharing your valuable insights with us. It means a lot, and in terms of educating our audience, motivating our public, especially women, to go and take charge of their health. And if a woman is healthy, a complete family is healthy. If a woman is not healthy, the entire family is disturbed, I believe then. So it's an ecosystem based on her. So thank you so much for stressing on that, educating and motivating our audience for this on this important cause. It means a lot.
Thank you so much.
Thank you.